Here's an opportunity. It's a fast expanding field with a lot of room for you to grow into a position. Richard Kasmer is with us. He's the Dean at the Northeast Ohio Medical University's College of Pharmacy. It has a lot of words to say. Is there an easier way to say it?
Yeah, we would just call it NEOMED, David. It's much shorter and easier to remember.
NEOMED. Okay, so this school is out near the Ravenna area, also a medical school.
Yeah, NEOMED is actually located just outside of Ravenna, Ohio. We're actually in Rootstown, Ohio. And we have three colleges primarily. We have a College of Medicine, College of Pharmacy, and College of Graduate Studies.
Great, okay, and today we're talking about College of Pharmacy, and it's almost ironic for me. I was just at the pharmacy Saturday. I was getting my vaccinations, and there's all this big lot of help going on behind, but they were telling me, like, oh, we're a little short of help today, like we need some more pharmacists. And I get to talk to you today, and this is what it's all about, is making people understand and become interested in becoming a pharmacist.
That is exactly correct. And my best guess is on Saturday you were immunized by a pharmacist.
I was immunized by a pharmacist, and the other thing I noticed was I was not the youngest person there, but I was among the oldest.
That probably would be the case, yes.
Yeah, that's how it goes. So people probably don't think about becoming a pharmacist when they're in high school or maybe already into their college career. Why should they be thinking about that now?
I think the profession of pharmacy is a great profession. It clearly is in the healthcare field, and it clearly over the last probably decade or so it's been expanding at a relatively quick rate.
I understand too, I was looking at some of the notes you provided, that it's a doctorate diploma when you finish this.
That's correct. In the early 1980s, the profession made the intentional decision to upgrade the profession. So back in the 80s, it was a 5-year BS degree, and today it's a 6-year Doctor of Pharmacy or a Pharm.D degree.
And the other thing I found most interesting was the fact that you don't have to have like a Bachelor of Arts degree or a bachelor degree to get started in this.
No, that's exactly correct. For most students who are in the undergraduate setting, we get most of our students who actually have concentrations in biology, chemistry, or biochem. And the point of entry is actually you have to complete at least 2 years or 60 credit hours before you can progress to a professional school. So the point of entry is actually very attractive for many college students. We see, however, that about 2/3, maybe 3/4 of our students actually do have a bachelor's degree, though.
Yeah. So, you know, it's interesting that kids start school. I had 2 kids go through college in the beginning. They have no idea what they want to do. They figured it out and they found a path. But there's a lot of kids that get to their 3rd year, their 4th year, and they're still wondering what I should do, what I should become. What do you say to those students?
Yeah, we do a lot of outreach work. We have a variety of programs at NEOMED, and particularly we call it the Early Assurance Program, where we have pre-pharm clubs in a lot of our undergraduate universities, and we do a lot of visits to high school students too, to help them introduce the topic to them to become a pharmacist and at least allow them the opportunity to explore it as a career. So we do a lot of outreach work, no doubt.
And I find it interesting that becoming a pharmacist could just become a stepping stone to something else.
It could be. There's many career paths that an individual can take. And there was a book that was written maybe 10, maybe 15 years ago, which talks about what you could do with a pharmacy degree. And I would view it as really a platform degree. So that once you have your degree, you actually have about at least 90 different career paths that you can follow. I use myself as an example. I'm a pharmacist first, and I'm a lawyer second. And what I do is actually my area of expertise is pharmacy law. If you think about a hospital setting or a drugstore setting, you have your drug supply, and there's a lot of federal and state laws that you have to be very well aware of, and know how to do what, and to make sure the drug supply is safe and properly managed. So it's an area of expertise that I have.
It sounds excellent. So what are some of the rewarding opportunities in becoming a pharmacist, you think, on a personal level?
Well, I think it's a very rewarding opportunity. You do a lot of direct patient work, no doubt. So pharmacists today are really direct patient care providers. Many of them really have what we would call advanced skills. So we work with them when they're in college to develop those kind of skills. Yeah. So for instance, a lot of our pharmacists today do what's called MTM, so medication therapy management. We work with physicians or directly with patients on really high complex medication regimens.
Right.
In your case, we do a lot of immunizations. Plus there are pharmacists who do direct patient care like diabetes care, hypertension care, lipid, antibiotics, mental health, many different things.
Very interesting. Okay, so if somebody's out there listening, what should they do right now if they might be interested in this? I want to learn more.
So we at NEOMED, we do career visits throughout the calendar year. Our season for recruiting starts, I would say, in the July timeframe every year. You can go onto our website at NEOMED and actually schedule a visit and come out either yourself or come out with mom and dad, and we'll spend 2-3 hours with you as a student with mom and dad, kind of walking through what the process might be.
You know, me being an old guy, I remember the Andy Griffith show in Mayberry. You know, the pharmacist. He was one of the tent poles of the community. You know, and now as you describe it, you know, you have like 4 or 5 pharmacists working in one place, and they're sort of like the people who take care of, maintain what your health is or should be.
Absolutely we do. And actually what we do at NEOMED in many schools today, we do what's called interprofessional education. We take our pharmacy students with medical students and nursing students and other healthcare professionals, and they train side by side for a several year period of time. And we believe it teaches them to learn how to work in teams, and actually we also believe it improves healthcare outcomes at the end of the day.
So there you go. You should get in touch, check this out. Parents out there saying, like, I wonder what my kid should be doing right now. They should have a little conversation, right?
I would say become a pharmacist.
Become a pharmacist. Thank you very much. Great to see you, sir.
Thank you, David.
Appreciate all the information.